Good morning, and thank you for this opportunity to discuss RA 11166 and also TransHealth. Kanina nakababad ako kasi I really wanted to learn because TransHealth is fairly new, no, in the Philippines. And for the longest time, our friends in the LGBTIQ community, mostly transgender, trans men and trans women, they go pa to Bangkok just to access TransHealth. And it's a good development that we have here, TransHealth services. We will discuss RA 11166 or the HIV and AIDS Policy Act of 2018. But I will focus on the remedies, the violations and the remedies, and later on, yung bago, the redress mechanism developed by CHR, DOH, PNAC, and DOJ, the Department of Justice. This is a fairly new law, 2018, when it was enacted, and it focuses on the prevention, treatment, care, and support services of PLHIVs and key affected populations. So, hindi lang to limited dun sa people who actually tested positive. So, the entire key affected population, we opened intentionally the application of the law to those in the key affected population, and even not define the key affected population as in the law itself. So we allowed PNAC, we allowed CSOs, we allowed people, professionals, and the community itself to later on, baka kasi magbago yung landscape, magbago na naman. So the intention really is to cater not just PLHIVs, but also key affected populations. So what's new in this law? It's a spectrum. So lagi sinasabi ng DOH at that time when they were lobbying for this law, PNAC most especially, it's prevention, treatment, care, and support, the whole spectrum. So linked to treatment talaga yung framework of this law. And we wanted at that time evidence-based strategies in the law itself, principles of human rights, gender responsiveness, age appropriateness, and of course, meaningful participation of communities affected by HIV and AIDS situations, especially PLHIVs. So bakit pinalitan yung dating batas? So before, there was an old law at the time of si Sarah J. Salazar. Siya yung mukha ng previous law. She was the one visible na nakikita na naglalobby sa Congress and sa Senate before. And after that, there was a change in the landscape. Nagtumaas yung incidence sa MSMTG, as you know, and then bumata yung epidemic. Nagkaroon ng 15 years old na pagtaas ng incidence. And then the services and the programs did not cater to the marginalized, the vulnerable, the criminalized communities. So tumaas din yung incidence, HIV incidence sa people who use drugs, specifically people who inject drugs, sex workers. So in the old law, may mga naiwan dun sa response. So tumaas pa rin yung incidence even if we already have an old law because it catered to general population. Hindi na-encapsulate ng old law yung landscape ng epidemic. Na ito dapat yung pinaprioritize natin sa services and programs because nandito yung pagtaas ng incidence, and of course, ito yung mga population, key affected population, na hindi nakaka-access ng health services in general. So because of that, we wanted all of these principles in the new law, especially evidence-based strategies. At the time the old law was passed, meron ng ARV, pero hindi pa siya accessible sa Pilipinas. Kaka-imbento pa lang, 90s. Pero hindi pa, at that time, during the old law, hindi pa siya pinoprovide, sinusubsidized ng Philippine government. So wala pang access. Also, the key affected population recognizes SOGSC. So that's why we use MSMTG, men of sex with men, transgenders. And we wanted age appropriateness kasi nga bumata. So we wanted specific services for minors. And we had to address the barriers for these access. And of course, we added PLHIVs, members of the community, in the PNAC. And even in the local AIDS council, we advise local government units with ordinances to increase the participation of PLHIV. So they have to have CSO consultants, they have to have peer educators from the community itself, and they have to have PLHIVs in the decision-making process. Yun yung key principles ng bagong batas. What else is new? Ngayon ko lang din nakita how people in the streets react to a specific provision in the law. Because this was a debate. This was a very, very rigorous debate in the Senate and in Congress because we're allowing minors to access HIV testing without parental consent. So di ba 18 years old ang ating age of majority. So at 18, you can vote, you can drive, you can drink, you can get married with parental consent. So 18 is our age of majority. And the question was, why are we allowing minors without their parents to access HIV testing? And the short answer that we always give them, actually later on na rin namin na-articulate, di ba? Because nauso na yung sino ba mag-a-adjust? Yung virus ba o yung batas? That's the question. So because 15 years old, second, di ba, ng highest number of incidents, kailangan na nila ng HIV testing at the very young age of 15. And secondly, nagiging barrier kasi yung parental consent for 15 years old minors to access HIV testing. Most of our documented cases came from situations wherein strange yung parents, napalayas kasi Becky or hindi pa out. Diba? Bakit ka magpapa-HIV testing? So magtatanong yung magulang mo. And also at the same time, there were kids, minors, already pregnant. Mataas din yung teenage pregnancy sa Pilipinas. I think number 1 tayo sa Asia and the Pacific when it comes to teenage pregnancy. Also, meron na rin involved in sex work. So parental consent became a barrier for these kids to access HIV testing. And the overarching principle when it comes to children's rights is the best interest of the child. So this is not something that would harm them. Diba? HIV testing would actually help them. This is their access to treatment. Diba? This is for their health. So right to health above all, most especially for children. So pinayagan na at 15 years old, pwedeng walang parental consent. Below 15, pwede pag pregnant or engage in high-risk behavior. Usually there will be a social worker who will conduct a case study and who will suggest that yes, we can have HIV testing, we can have treatment for this kid because he or she is already engaged in sex work. Below 15, if the parents or guardian cannot be found or refuse to give consent, this applies to cases where the kid is a victim of abuse. In most of the cases, domestic abuse committed, perpetrated by their own parents or guardians. So you don't ask the parent, di ba? Nandun na nga tayo sa situation na may domestic violence and that involves the parent. So you can't, this is not as if it pupunta siya sa field trip, di ba? At magpapapirma ka ng waiver. So this is access to testing and treatment. And of course, we also have data coming from maternal health that needed provider-initiated HIV testing for pregnant women. What we wanted, what the people, DOH, PNAC, and all the lobbyists at that time were lobbying for was access to ARV treatment so that there would be high probability, mas alam nyo to kasi kayo nasa medical field, high probability of non-transmission dun sa infant. So kaya inintegrate siya sa maternal health care. But this is provider-initiated. Ibig sabihin, the pregnant woman can say no, can opt out. But this is part of the package. So you have to offer it. You have to have counseling. You have to initiate it as a health worker. So what else? We have new and old prohibited acts. We have higher penalties, of course. We have to update those. And nilagay ko na rin yung remedy because it's not always courts. Maraming mga administrative agencies who can give remedies, who can give hearings, who can give penalties or sanctions to people who violate RA 11166. First off, misinformation. Of course, this is basic, lalo na sa health sector. So those that are spreading fake news about cure, fail-safe prophylaxis, those that are not approved by DOH or FDA, mas malaki yung violation pag manufacturer ka, importer ka, nag-advertise ka ng mga false na gamot, lalo na kasi pinagkakitaan mo pa, di ba? So, and distributor, of course. So, it can get you a fine of 5 million, di ba? Tsaka 10 years of imprisonment. But usually in these cases, they don't go to court na. They go to DOH, FDA, or PRC. Sample, mga professionals yung nag-commit. But any person can commit misinformation. And I always tell this in the communities, in the barangay, sharing of information kasi yung ginagawa ng mga people in the communities. And is also misinformation. Fake news, of course. When it comes to HIV, yung mga nagpapakalat ng, hanggang ngayon, meron pa rin kagat ng lamok yung mode of transmission, yung mga ganon. So that's also covered by misinformation. Unsafe and unsanitary practices, there's a DOH guideline. So as long as you comply with safe and sanitation code, you don't have to worry about this provision. Most especially COVID, pandemic, mas strict yung ating sanitary practices, and DOH issued guidelines that we have to comply with. The Prohibited Act, or the cause of action that will trigger this prohibition, is when there's a transmission by negligence. This has not yet happened, or there has not been a documented case wherein somebody filed against a health worker or a health institution, health center, or a hospital for transmission because of unsafe and unsanitary practices. Wala pang ganun. And it's also difficult to prove na kaya ka nag-HIV positive. It's because of this healthcare institution which did not comply with DOH standards. But it's in the law. Compulsory HIV testing. This is very contentious, most especially in the workplace, in the healthcare setting. You can't compel people to get an HIV testing. You can just recommend. You can strongly encourage. That's why we always advocate for counseling, pre-test counseling. So those are the only things that you can do. In the workplace setting, ginagawa nilang conditional. So pag nag-a-apply ng trabaho, hinahanapan nila ng HIV test result. So you can opt out, di ba? You cannot take it kung ayaw mo. Pero hindi ka makakapagtrabaho. Hindi ka makakapag-apply. So there are consequences. Nagiging compulsory siya, in effect. That's also prohibited because you're trying to skirt around the law. So if it's conditional, if it's mandatory, if you forced someone to take an HIV test, that's compulsory. And that has 12 years in administrative sanctions. They can go to the PRC, the LGU, if it's a social hygiene clinic. We've done that before. DOH, of course, and of course the regional trial court if they want to do the criminal justice route. So this is one of the innovations in the new law, and this has already been one of the victories for advocates and for the community to prohibit compulsory HIV testing, most especially because of documented cases wherein pag nagko-compulsory HIV testing, mas lalong nasi-stigmatize yung mga PLHIV, lalong nasi-stigmatize yung key affected population. In the end, in any other health program din naman, hindi effective yung may compulsion. Even COVID, di ba? Wala naman tayong kinumpel. You can't compel people to access healthcare. That's not effective. So you can't instill fear, you can't instill stigma. You can just encourage, you can just give advice, you can just give counseling. Conduct of raid in places of HIV prevention. This has happened before, and also connected to harassment of HIV and AIDS service providers. And it concerns you. There was this case which we handled in Cebu. So there's an outreach program nagde-deliver sila ng mga ARVs sa mga clients. This was during lockdown. So because there was a raid in the same neighborhood, hinabol ng mga pulis yung health worker na may dalang ARV. not knowing that there was a program, this was sanctioned by the City Health ng Cebu. These are actually DOH personnel na kasama, and yung mga peer educators, kasama sila doon sa HIV response ng Cebu City. And what happened was natapon yung mga ARV. So nagkaroon ng gulo and nagkaroon ng tension, which leads to, wala namang na-aresto dun sa mga HIV service providers, pero natapon yung mga ARVs. And in those cases, pwede ka talaga mag-NAPOLCOM, pwede ka mag-PNP IAS, yung kanyang Internal Affairs Services, CHR, because this is the government violating a certain law, DOH, of course, and for administrative sanction, and Ombudsman, because this concerns the police. There's also a case wherein a PLHIV client about to access ARV in a social hygiene clinic, but the police put him in handcuffs. So, violation yun. That's harassment also. And that's a violation of the conduct of rape in cases of HIV prevention. Kasi your social hygiene clinics, your treatment hubs, your health center, even if it's just a barangay health center, that's supposedly a safe zone. So nagiging barrier kasi, and later on I will discuss that, nagiging barrier yung government response against drugs and other laws because of we still criminalize certain behaviors in this country. And our problem here now is that most of our clients are criminalized, sex workers, people who inject drugs. Most of our clients are stigmatized, discriminated, MSMPGs. So if you don't make our healthcare setting a safe space, sino mag-a-access? Diba? So mahihirapang mag-access yung mga marginalized communities because we have those legal barriers and we have those law enforcement agencies that would arrest you at the point wherein you're supposed to access your right to health. So right to health above all, regardless if you're violating the law, you're violating the drug law, or you're a sex worker, or you're doing something else. Right to health muna. This is also another contentious provision, denial of health insurance. And this was one of the victories for advocates. Because in the law, it's explicit. You can't deny health insurance to a PLHIV. Even subsequent contraction of HIV, hindi na rin yan pwedeng pagbawalan. Pero later on, the health insurance companies and HMOs found a way to skirt around this provision. Most especially, we have Universal Healthcare Act. So all Filipinos are entitled to PhilHealth. So if we're entitled to PhilHealth, why are we allowing private health insurance companies and HMOs to discriminate? And also, I'm telling this to the health insurance companies and HMOs na still won't comply with the provisions of the law. Ang ARV ay subsidized by the government. So what is there to be worried about in terms of profits, di ba? In some other medical conditions that they cover, hindi naman subsidized yung treatment eh. So if they worry that the health insurance companies, the HMOs would not profit from PLHIVs, that's false. You already have treatment. You already have financial assistance. You already have something that is given by the government. So what else do you need to expend so much for a PLHIV? OIs, di ba? Pero you can just peg it with other medical conditions. So the hesitation is coming from discrimination. The hesitation is coming from stigma. They still don't want to cover PLHIVs because they thought, syempre profit-oriented sila. So they thought malulugi sila. But that's prohibited already. Violation of confidentiality. This is one of the topmost violations. Every Thursday, I do PLHIV consultations with Achieve, another organization. And one of their topmost cases, so discrimination in the workplace yung isa, ito violation of confidentiality. And Of course, any person can commit this. You can also be, even if with best intentions, may concern lang naman po ako doon sa kapitbahay ko. You can go to Katarungan Pambarangay. Mass dissemination, also online, when you post the status of another person on Facebook, di ba? Public. And then, of course, mas mataas kung health professional ka because you have doctor-patient confidentiality. So, you cannot violate those. Also, there is a Data Privacy Act. So, health status, even if it's not HIV, is a sensitive personal information. So, even if it's just arthritis, hypertension, diabetes, any medical condition, COVID, di ba? You have to ask permission. Ito lang naman na sinasabi ng provision na to. Unauthorized disclosure. So you have to ask permission from the person, from the client, from your patient. Can I disclose? Or of course, there has to be forms. Lalo na sa healthcare settings, may mga format naman yan. May mga waiver. So you just have to tell them that this is needed, this is for this purpose, and that their privacy will be protected. Yun lang naman yung kailangan doon sa form. And if they sign it, okay na, di ba? Wala ka ng liability. Pero you have to have that due diligence to have those forms. Most especially, hindi na lang sa HIV law, pati Data Privacy Act. Bago lang din yung Data Privacy Act, nas nahuli pa siya sa 11166. Pero we have to, and I think most organizations, institutions, are already mainstreaming that sort of culture of having this form, a data privacy form. And most especially sa healthcare setting. Hindi lang dun para dun sa tao, dun sa client, sa patient, but also the health professionals so that you can protect yourselves. Discriminatory acts, of course, this is most common in workplace settings. But one of the cases that I can't forget was this lying in clinic that they did not accept a pregnant woman who tested positive, who's about to give birth. So lying in clinic siya in a community, I think Pasay. So their justification was hindi daw sila equipped. The lying in clinic, I don't know, I didn't visit the entire thing, pero it could be an excuse, diba? If you're a lying clinic, you should be equipped, diba? And you should be compliant with all the standards. Pero this was a clear case of discrimination. That woman is about to give birth. So, ano pa yung choice niya? Pero anong nangyari? Pinauwi siya, pinasakay pa ng tricycle, and pinapunta to some other lying in clinic. That's discrimination. That should not have happened. Also, for healthcare centers, healthcare, even barangay healthcare center lang, kahit, of course, lalo na hospitals, di ba? Pag sa ER, you need to stabilize muna, di ba? The patient. Bago mo siya, if there are some conditions wherein you cannot treat or you cannot give healthcare services to that person, hindi mo siya pwedeng basta-basta paalisin. Baka mamatay siya along the way, di ba? And nangyari na yun. In the context of anti-hospital deposit, there was this case in, I think, UST ata yun. Manganganak na rin yung bata. Pero does not concern HIV. Pero the lying in clinic in Pasay, which I was telling you about, that was the issue. So the pregnant woman was also PLHIV and she was discriminated. So in all settings ng discriminations, pwede kang pumunta kung saan siya nag-a-apply. So if it happened in the education sector, so you go to DepEd, CHED. If it happened in the workplace, you can go to NLRC. And if what's committed by a professional, you can go to PRC, DOH, and of course, if you want criminal sanctions, you can go to the regional trial court. Ayan, we go to implementation issues. Konti lang to, and then we'll go to redress mechanisms. Konti lang din yun. Just to give you a sense of where we're at when it comes to the implementation of this 2018 law. We specifically lobbied for a comprehensive health intervention for key affected populations. So if there are people who inject drugs, the idea is for them to have harm reduction services. So you can give, if they're injecting, so you can give clean needles, unused needles, syringes, and those cannot be used as evidence for RA 9165 or the Dangerous Drugs Act. Also, you will be protected as an HIV educator, licensed social health worker, health workers, HIV/AIDS service providers, including peer educators. So those peer educators who are also people who use drugs or people who inject drugs and also PLHIVs should be protected by this law against police, against, in some cases, PDEA, because this is all part of the HIV response. So if it's a needle syringe program, it should be okay. If they want to access ARV, even if they're people who use drugs or people who inject drugs, it should be okay. So these are safe zones. Yun lang yung sinasabi. Hindi lang yung setting, but also the people who work inside the healthcare facility. Lahat sila protected. There were cases kasi before, yung syringe, ginagamit siya kasi Section 12 ng RA 9165 prohibits paraphernalia, drug paraphernalia. And syringes, and we argue this in court, na dapat meron, at the very least, meron kang residue, di ba? Syringes can be used various functions, di ba? Ang syringe, glutadrip, di ba? Vaccines, everything, hormones, di ba? So, medyo outdated na kasi yung ating RA 9165, yung ating dangerous drugs law, that even syringes can land you in jail. So, yun yung nagiging problem. There's also certain documentations before, pati condoms, ginagamit na evidence for sex work. So, there was this raid wherein nakakita sila ng condoms dun sa facility, actually outside na to eh. Pero nakakita sila ng condoms, and this was dismissed kasi condoms lang naman yun. Pero the police used condoms as evidence of sex work. So yun yung nangyayari. So we wanted in this law protection for people who are involved in the HIV response, people who are working within the program and in the healthcare facilities wherein HIV responses, services, and programs are delivered. Some of the implementation issues nabanggit ko na. So we have problems when it comes to the campaign against drugs, most especially in the last 6 years wherein there was this intensive campaign, and we're all familiar with this. And most of the people that were targeted, those in the list, were also our clients, also our patients. So they are people who inject drugs, sex workers, even TGs, trans women who are doing sex work. They can't access health service because of fear of being included in the watch list or ma-raid ng mga police. So yun yung naging problema when it comes to implementation of the HIV law, because in the eyes of RA 9165, they're criminals. Pero in the eyes of 1166, they're pre-affected population that we should cater to. So there's tension with these two laws, and that became an implementation issue. Possession of paraphernalia, as I've said, it's prohibited under Section 12 of RA 9165, and we should update this law because we have key affected population, people who inject drugs, who needed needle syringe programs. So it should be allowed. And syringes, it's not automatically a drug paraphernalia. There's so many other uses for syringes. It should not be included in the drug laws. Katarungang pambarangay versus confidentiality. This has always been a problem when it comes to violation of confidentiality. Lalo na yung mga nagpo-fall under katarungang pambarangay. So this is any person verbally disclosing the status of another person and they live in the same barangay. So covered sila ng katarungang pambarangay. In short, mga marites sa barangay. And the problem is that when a PLHIV or suspected PLHIV go to katarungang pambarangay for redress or for a hearing or to file a complaint against the marites in their barangays, lalo sila And most of the time naman, our hearings in general should be public. But there are sensitive cases, most especially kung confidentiality nga yung, violation of confidentiality yung nga yung nirereklamo mo. Pero when you access a redress mechanism that should be available to you, lalo kang napahamak, diba? So, people who, the PLHIV, suspected PLHIVs, those who want to complain, opt out of the katarungang pambarangay. Pero they can't, that's part of the procedure. That's why we have a redress mechanism. And I'll talk a little about executive session, privacy, and confidentiality inside our katarungang pambarangay and our courts. Minors' access to treatment. There have been doctors, healthcare professionals who didn't want to cater, didn't want treatment for minors without parental consent. They're saying na hanggang testing lang daw. Pero kasi the framework of this law is linked to treatment. So hindi naman pwedeng tinest mo lang yung bata and then hindi mo tinreat. Mas lalo na yung treatment, di ba? Because that's essentially the point of HIV testing. Diba? Malink mo siya agad sa treatment. Why would you deny a minor because of lack of parental consent when you already know that that's for the best interest of the child, that's needed, that's necessary, and that's immediate concern, di ba? So minors should have access to treatment. It's the same thing as hindi mo na tatanungin pa yung magulang ng bata kung gusto mo, kung masakit yung ulo niya, bibigyan mo ng biogesic, di ba? Kailangan mo pa ba nung parental consent? I know this is very contentious, lalo na sa healthcare setting and lalo na when implemented, maraming tanong dyan. Ang dami kong naririnig na mga healthcare professional who doesn't want to be sued by the parents or the guardians. So syempre, even if we tell them that, no, you're protected, no, it's in the law, pero you don't want the hassle of parents, guardians coming over and threatening you with legal sanctions, diba? You don't want that. So it has to be something that should be discussed with the parents. That's my number one advice. So parents kasi are coming from a very alarmist, very what do you call this? Also, may stigma pa rin di ba? Pag HIV So hindi siya kagaya ng ibang medical condition. They still want, they don't want them for their children. I don't know why. Pero you have to educate the parents. What are ARVs? What are they for? They don't need to panic. And that's why counseling kasi, lagi ko sinasabi, hindi lang doon sa PLHIV. Even yung families, they need counseling. Lalo na pag may minor at lalo na kung may ganitong parental barrier to access. So you have to provide counseling also to the parents. And baka referral mechanism na to, baka hindi na mga taga-healthcare settings yung magbigay. Social worker can provide this. Peer educators can provide this. Voluntary HIV testing and mandatory disclosure, usually sa workplace to. So and usually OFWs, kasama siya sa pre-employment medical examination. So nire-require ang HIV testing. Even if in those countries wherein the OFW will be deployed, hindi naman kailangan ng HIV testing or hindi naman necessary for anything, any requirement. Pero yung mga recruitment agency sa Pilipinas, they still require it. Kasama lahat, drug testing, medical history, lahat na ng testing, isasama na nila as a package. Kasi yung mga diagnostics, nakapackage na siya that's a violation of the law. Kasi you make it mandatory and you make it conditional to something as important as right to a livelihood. Diba? So they can't access their right to livelihood because you put in HIV testing as a barrier. It should not be a concern. Medical confidentiality confusion. This is also one of the issues within the healthcare setting before, during the old law, akala ng mga healthcare professional, hindi ka pwedeng mag-disclose doon sa, kunwari, nurse, hindi ka pwedeng mag-disclose doon sa another nurse. Pero same patient naman kayo. Or anesthesiologist, hindi mo pwedeng i-disclose. Of course, mas alam nyo yung setting. Pero another doctor, for an OI, for example, hindi niya pwedeng i-disclose na sa another. When you're treating the same patient. So, in the law, in this new law, explicit na that there's a concept coined as medical confidentiality. So, you can share information within the healthcare setting if it's for the same patient. Diba? You're all involved in the treatment process. So, you have to share information, and that's not a violation of confidentiality. That's part of the patient-doctor confidentiality. And with the Data Privacy Act, syempre nandun na lahat ng waivers and everything. That ang purpose natin is to give the best treatment there is. And to get that, to be able to get that, you have to share information, certain information. Of course, this is health. So yun yung ating concern. This is the definition. So the patient's health status can, however, be shared with other medical practitioners involved in the professional care of the patient, who will also be bound by medical confidentiality. This applies most especially in cases wherein you have to refer your patient or your client to, for example, medtech or, gawin natin contentious, social worker. Diba? Sabihin, hindi naman siya healthcare provider, although mental health. Pero lalabas ka na dun sa healthcare facility, so baka hindi na siya makover ng waiver. You have to have a waiver din pagka magre-refer ka. Pero medical confidentiality applies to everyone involved in the treatment. So if it's a mental health concern and you have to refer them to a psychologist, psychiatrist, counselor, social worker, kasama na siya. In effect, you can share that information. Pero I would always suggest have a waiver, have a data privacy form para protected kayo lahat. Diba? And wherever you refer your client, for example, social hygiene clinic, treatment hub, or kung saan man na mas magki-cater nung needs or mas makaka-access ng services and programs yung kliyente, you have to assure them that you're sharing this information for the purpose of treatment, for the purpose of access to financial assistance, for example. So you have to be explicit. And there, syempre, you have to have the signature of the patient or the client. Importante yon. Other implementation issues, may nag-message na sa akin about sanitation code. And there have been revisions. I have to check because we handled a case which concerns sanitation. So the PLHIV due to OI died, I think, Quezon City Hospital. But the problem was Cebu Pacific pala. So we have to fly the body to Surigao. And hindi kami pinayagan ng Cebu Pacific. We needed another death certificate saying na yung OI, so immunocompromised lang yung nakasulat, and then they use the sanitation code. So if the person died of virus, kasama na HIV, they have to be cremated. So hindi na siya updated. So there has to be a sort of harmonization of the sanitation code with RA 11166. And later on, pinayagan naman din, pero we have to ask the Quezon City Sanitation Department just to give us a certificate just so we can fly the body to Surigao because of Cebu Pacific. So sila yung nagkaroon kami ng problema. Pero I think I'll ask pala you later kung ano na yung status ng revision ng sanitation code. Hindi lang to for HIV, marami rin naman kasi na mga contentious issue sa sanitation code kasi nga hindi pa siya na-update. Health insurance, as I've said, nagiging problema dito, tumataas naman yung premium. And there's this insurance company. Kanina pa pala ako nagpapangalan ng mga involved. Pero there's this insurance company which, so bawal na mag-deny, di ba, ng coverage according to 11166. Pero ang ginawa ng insurance company, I think HMO, ang ginawa niya, 30% lang daw. Pag PLHIV ka, 30% lang nung premium, 30% lang ng benefits yung makukuha mo. Kasi PLHIV ka. That's discrimination because nagbayad ka ng tamang premium. And at the same time, this is HMO. So lahat kayong ng mga empleyado, entitled kayo dito kasi pinagtrabahuhan nyo yun di ba? You put in work. So yung company nyo, nagbayad ng HMO to cover everyone. Pero dahil PLHIV ka, suddenly, hindi mo makukuha yung full benefits. Yung isang tao na may, for example, kung anumang ibang medical condition niya, makukuha niya. Pareho lang naman kayo ng trabaho, pareho lang kayo ng sweldo, pareho lang kayo ng job description, pareho lang kayo nung work na pinagtrabahuhan nyo that entitles you to an HMO. So, di ba, because you're PLHIV, na-discriminate, 30% lang. So, that's very discriminatory. So, yun yung ginagawa ng mga health insurance and HMOs ngayon. So, they work around the policy, tsaka yung premium. I don't know. This is an ongoing conversation with the Insurance Commission. So they have to have a certain memorandum circular, a new memorandum circular, so that we can standardize the premiums, the benefits, everything that has to do with PLHIVs accessing insurance. Latent discrimination, this happens all the time, most especially sa workplace. Kasi nga, they will not fire you for being PLHIV. They will not do that. That's a clear case of discrimination. Natalo na si Ricky Reyes dyan sa NLRC. Pero they will use other justification. So they will use all your absences, your insubordination. Pero at the end of the day, it's because you're PLHIV. May ganon. So that's latent discrimination. And that's a matter of evidence yan. And that's problematic. The example in the healthcare setting, yun nga, yung sinabi nung lying-in clinic na hindi sila equipped, diba, to handle PLHIV pregnant woman. Yun yung kanilang excuse. Pero, underneath it all, ayaw lang nila mag-handle ng PLHIV pregnant woman. Diba? That's discrimination. Why are you not equipped? Is that an excuse? Diba? You can't just get everything, certificates, permits to establish a lying-in clinic and then sabihin mo ito lang yung magkikater ka. Ito lang yung pwedeng pumasok sa lying-in clinic mo. That's health That's right to health. So it should be available to everyone. And of course, lastly, cyber libel. Nagiging problem to kasi in most cases, lalo na ngayon, the violations are online. And ang hirap, lalo na because most of them are anonymous, alter accounts. So, ang hirap hanapin sino ba yung kakasuhan mo. So we always ask the Cybercrime Division sa Karingal, that's PNP, and NBI. So they have a Cybercrime Division just so we can track sino ba yung ano. Because most of the perpetrators, they won't show their face, they won't tell their real name. Pagka-post nila, tatanggalin nila agad. So kung di mo na screenshot, wala kang ebidensya. So it's a difficult terrain online. And the good thing is that hindi lang siya RA 11166. It's also a cybercrime, cyber libel. So there's another law protecting you online. So yun. Very quickly lang, I have another slide on redress mechanism. Redress mechanism, this is new because this is a memorandum, a joint memorandum, imagine, by the PNAC, the DOJ, and the CHR. We were able to convene them, very rare occasion, wherein they vaulted in, nag-collab sila, and they wanted to protect PLHIVs. And of course, healthcare providers under the HIV law. And this is a special rules of procedure with regards PLHIV. So hindi siya applicable in some other cases. Pero PLHIVs, those in the HIV program and the affected population can benefit from this redress mechanism. Nadaanan na natin to. Ito yung mga prohibited acts. Because of the implementation issues I've mentioned, ito yung mga ginawa natin sa redress mechanism. So HIV/AIDS related information of any PLHIV party shall be kept strictly confidential. So there has to be written consent. And the proceeding should be in executive session. So all our trials in general are public. So if you go to court, nandyan lahat. So 40 cases a day, nandyan lahat ng parties, lawyers, even mga walang kinalaman doon sa mga cases, pwede silang pumunta. It's open. Pero if the cases are sensitive, for example, rape, minor, usually hinuhuli siya sa calendar ng court kasi pinapalabas lahat. Yun yung ginawa natin for cases which involve PLHIVs and key affected population. So if they have a hearing, it should be executive session, meaning judge, clerk, lawyers, those that will be needed to testify on that day, parang ganon. So yun lang, very minimalist, di ba? Yun lang yung attendance dun sa hearing. So hindi siya bago. Minors, vowsy, even sa vowsy bawal yung yung husband, yung perpetrator. Pag ni-request nung complainant na ayaw niyang makita kasi natitrigger siya, pwedeng palabasin. Minors, pwedeng hindi siya same room, diba? Naka-teleconference para hindi niya makita yung abuser. For PLHIVs, pwede na rin natin siyang magamit. So ibig sabihin, you have your lawyer has to request for an executive session. The records of the cases shall be classified. In rape cases ng minors, ang makikita mo lang sa mga records, AAA, diba? BBB, walang pangalan ng minor. CCC, ganyan lang siya, classified siya. So redacted yung mga personal information. They have to be protected. Yung identity, yung address, everything that could lead to the identity of the person involved. And this is not just under RA 1166. As I mentioned, there's a Data Privacy Act. So you can invoke the Data Privacy Act just to protect your status or your suspected status, suspected or perceived. So pag magrereklamo ng unauthorized disclosure, ang sinasabi ng redress mechanism, we don't allow further harm. Kasi nga, there will be hearings, there will be procedures, nagkakaroon ng further violation of confidentiality. So we don't want that. We want the same protection to minors, to sensitive cases, for PLHIVs and key affected population. You can go to the PNAC, Human Rights Committee, and they can provide legal assistance, consultation, representation, witness protection, and other services for a PLHIV. So pwede yung psychosocial, hindi lang siya puro legal. Financial, livelihood, they can have referrals to the DSWD kasi PNAC naman, marami namang members ng government agency. So they have DSWD in the PNAC, they have of course, DOJ, CHR, DOH, of course. So pwede, pati mga CSO partners ng PNAC, pwede nilang pag-referan, whatever is needed. So not just legal, yung PNAC Human Rights Committee. You can also go to the CHR. So they have free legal assistance, they have an investigator, and they can be your lawyers. So they can investigate, and if their resolution is for the filing of a certain case in court or in an administrative agency, they can initiate that case. So ito yung pwedeng gawin ng CHR. What else? The CHR can also monitor PLHIVs and KAPs in closed setting institutions. So ito yung sinasabi natin that the rights of PLHIVs and KAPs don't stop after they're incarcerated or they put in a rehab facility or they're in jail kasi hindi sila maka-afford ng bail. So they have to have access to ARVs. Ang dami kasing nalolost to follow up. Lalo na yung mga nakukulong. So the CHR can monitor the access of PLHIVs and key affected populations inside jails, inside even mental health institution kasi closed setting din siya eh. So lahat ng closed setting institutions, they have to provide HIV services. The Department of Justice will designate at least one special prosecutor who shall handle PLHIV cases. So we have a parang special lane sa DOJ. Of course, may procedure. So 10 days, they will have an investigation and then they will conduct mediation muna. Pero the office that you can go to or you can refer your clients to is the DOJA. That's the Department of Justice Action Center. Sa Padre Paura, they're also online. They have a hotline. They have a website. So you can refer your clients, your patients to Department of Justice Action Center, and they will have a special prosecutor for PLHIV, key affected population cases. So what else? This one. This is one of the most innovations, one of the most innovative features of the redress mechanism, because you don't have to be indigent to be entitled to a public attorney, at least for PLHIVs. So if a PLHIV wants to file a case, they can have free legal representation, even if they're not indigent. Ang kailangan kasi may certificate of indigency and everything. Pero sabi ng PAO, sabi ng DOJ, you don't need to pass the indigency test. You don't need certificate of indigency. They will provide lawyers for PLHIVs for free. NBI, of course, they also opened their doors for cases, violations of RA 11166. Most especially kailangan to pagka mga cybercrime and you don't have evidence yet, so they can investigate for you. So that's the benefit of having a special lane NBI. And of course, Katarungang Pambarangay. We've been talking to LGUs. We've been training some of our Lupon tagapamayapa so that they will be equipped in handling PLHIV cases so that people will actually trust the Katarungang Pambarangay, and those who have complaints for unauthorized disclosure, violation of confidentiality would not be discriminated in the community. So tinuturo na rin namin paano mag-conduct ng mga executive sessions para hindi napapagchismisan yung mga PLHIVs or mga MSNTG who would want to seek redress in the Katarungang Pambarangay.